Natural Health Show would like to welcome Dr. John Hayes Jr. Since 1981 in private practice, specializing in successful multidisciplinary healthcare with a focus on integrated case management. Dr. John has extensive clinical background. He's the author of Evie-nominated Living and Practicing by Design and the Outskirts bestseller, Beating Neuropathy, Taking Misery to Miracles in 5 Weeks. Dr. John, welcome.
Mark, thank you. Thank you so much.
Great to have you here. And, a lot of folks may not know exactly what neuropathy is. Why don't you help us out there?
Well, neuropathy, Mark, as you know, is a term for nerve damage, if you will. What a lot of people are unaware of is that neuropathy is a condition that afflicts over 20 million Americans.
Wow.
Yeah, and several thousand more cases each year. It's a very, very significant health problem in the United States and in other developed countries, too.
And what really are the common, for folks who don't know, what are the common symptoms of neuropathy?
Well, the most common symptoms would be tingling, numbness, burning, and we're talking, not just a simple I whack my elbow, funny bone type thing.
Right.
We're talking about something very, very intense, life-disrupting to the point that oftentimes medications are not helpful or very, very, helpful for very limited periods of time.
Right.
It can be very, very a debilitating condition.
And for those folks, again, who may not know, what exactly causes what you refer to as nutritional neuropathy? And really, what is nutritional neuropathy?
Well, nutritional neuropathy in particular, Mark, would be neuropathy and nerve damage that results as a result of some type of dietary imbalance, if you will. I think more often than not in our society now, nutritional neuropathy is probably related to what's called metabolic syndrome or prediabetes more than anything else.
And I'm assuming that in your very special book, Beating Neuropathy, these are all issues that folks can really delve into in far greater detail.
Absolutely, yep.
So with the nutritional component of it, what specific nutrients or what kind of nutritional elements are the most common to be concerned with neuropathy?
Well, the most common, especially in the early stages of patient care or working a patient up, so to speak, would be to check things like vitamin B12 level, folic acid level. Those are two of the more common nutrients. But, besides that, we see a lot of people who have nutritional neuropathy as a result of, like we said, metabolic syndrome or prediabetes, which is basically where, we go on through middle age or so carrying 10, 20, 30 extra pounds. Before we know it, we have all these other issues like elevated cholesterol, high blood fats, and so on and so forth. But what a lot of people don't know is that you can have these symptoms of neuropathy, such as tingling, numbness, burning, aching, etc., which can begin very, very slowly, very, very innocently, so to speak, and then over time they get much worse to the point they can be very, very debilitating.
Now, in your book, Beating Neuropathy, you also speak about additional underlying illnesses. Why don't you talk about those a little bit?
Well, the most common illnesses that we see in our practices of patients that suffer from peripheral neuropathy would be those patients who have undergone chemotherapy, have had cancer. The other diseases that we see, diabetes is right up there. At one point in time it was thought that diabetes was the #1 cause of peripheral neuropathy. Now it looks like it's probably being eclipsed by other illnesses. Unfortunately, many times, Mark, as you know, we can't precisely identify what has caused the patient's neuropathy, but do everything we possibly can to assist them in their recovery.
We're speaking with Dr. John Hayes Jr., and he's just completely blown the world out here with a great, great book, folks. A book you're definitely going to want to take a peek at, Beating Neuropathy. It's an absolute must-read, and there's a section in the book that talks about nutrition as being a secret weapon for neuropathy.
Absolutely.
Talk about that a little bit.
Absolutely. Well, Mark, as you know, nutrition status is one of the things that in our society, and in the United States in particular, oftentimes gets overlooked until everything else has been looked at. I know you and I are exceptions to that rule. Historically, we've always practiced differently. We look at it from the nutrition aspect first. And, having both been trained in nutrition, that's kind of natural for us. But unfortunately, unless patients who have neuropathy take a real hard look or work with a professional that takes a hard look at all the nutritional components, they have a very, very difficult time managing the neuropathy regardless of the cause.
Right. But, I think there are specific nutrients, too, that folks probably are not aware of. You mentioned vitamin B12, for example.
Yep, B12.
And the same thing is true for foods. I mean, when we think about nutrition, of course, we got to really focus on the key of nutrition, which isn't the. People tend to think the supplements are the key. It's really all about the foods.
Correct.
So what kind of foods might someone who's suffering from neuropathy really want to focus on and think more about?
Well, primarily vegetables, believe it or not. We used to say fruits, but the problem with a lot of fruits is that it's difficult for patients to control their blood sugar levels
Right.
by consuming too much fruit. So the mainstay of the diet should be vegetables and then lean protein, for sure. The exception to that would be starchy vegetables like potatoes and carrots, which you want to limit. But primarily vegetables, lean protein, should make up the bulk of the diet.
Well, and as you say, your body runs on what you feed it. So a lot of folks are not aware of the fact that they actually increase probability for negative symptoms by eating poorly.
Correct, no question at all. And this is something, this is one condition where you can actually observe from day to day fluctuations in a patient's symptoms depending upon how well they're eating.
Now, one area that I'm really curious about too is, and I know a lot of folks probably are as well, the idea of neuropathy really sort of being directly overlapped with issues that are more bowel related, like Crohn's disease, digestive problems, gastritis. What is the direct connection there between nutrition, neuropathy, and the digestive tract?
Well, there's a huge connection because, as you know, unless the GI tract is fully functional, we can't absorb nutrients properly, we can't process things like fat-soluble vitamins and so on and so forth properly. Well, a lot of people are aware, for example, that the nervous system, in particular the brain, is very, very vulnerable to changes in things like oxygen and blood sugar level and nutrient level, but they're not also aware that the peripheral nervous system, in other words, the outside of the body that's connected to the brain, so to speak, is just as vulnerable.
Right.
That's why there's a whole host of disorders that are related to or can cause peripheral neuropathy.
Well, and a good percentage of the nervous system runs through the digestive tract and the immune system.
Absolutely.
So the body is really a single unit of all sorts of interconnections, and I think people need to really understand that we have an affinity for compartmentalizing, but nutrition really drives home the point that the body is unified.
Correct.
And so too is the mind. And I think
Correct.
there's probably a direct connection as well that we should talk about a little bit between the mind-body connection and neuropathy, stress, if you will.
Yeah, it's huge. It's huge because stress affects hormone levels. It affects plasma cortisol levels, which in turn affects blood sugar levels. We also know that many times patients that are stressed or especially over a long period of time, are much more prone to develop certain diseases and illnesses. And unfortunately, a lot of those diseases either have neuropathy as an accompanying symptom, or sometimes could be neuropathy.
Well, then there's that connection too between the mind-body stress connection and nutrition from the perspective of eating poorly increases the risk factors for very stress-like symptoms. And it's more difficult to kind of hold that nervous system together when you're eating a lot of sugar, a lot of caffeine, a lot of alcohol, and white flour.
Correct. Yeah,
So
no question at all.
So, Dr. John, why don't you give us your vital information in terms of folks might be interested in certainly purchasing the book. Where can they get the book? What about website and telephone information?
Okay, well, the book's available on Amazon. It's also available at Barnes & Noble. You can also find it in most local retailers and some local drugstores as well. But if you'd like a web link, if you go to our website, which is neuropathydr, the letters dr.com, or call my office staff at 781-659-7989. We'd be more than happy to assist you in getting a copy.
Dr. John Hayes Jr., and I love that subtitle, Taking Misery to Miracles in Just 5 Weeks, Beating Neuropathy. Thank you so much for being on board.
Thanks, Mark. Pleasure.